Hello, everyone, and welcome to today's special podcast session of Aesthetics Zone Medisys Private Limited. It's a privilege to have one of the most respected names in dermatology and aesthetic medicines, Dr. Lipy Gupta ma'am, with us today. Our guest has made significant contributions to the field through clinical excellence, innovations in education, helping shape the future of aesthetic practice. Doctor, thank you for taking the time to join us today. We are delighted to have you on our platform.
Thank you, Varsha.
Before we start discussing Filmid art fillers and NCTF 135 HA, could you please introduce yourself to our audience and tell us a little about your journey in dermatology and aesthetic medicine?
So, I am Dr. Lipy Gupta and I'm a practicing dermatologist and an aesthetic physician in Delhi for the last 18 years. And overall, I have seen the dermatology aesthetics really evolving from injectables to fillers, now to regenerative medicine. We have newer molecules and more safer techniques which have come into play. Learning them, practicing them, and doing it for our patients is the biggest achievement what we see daily. We see a lot of change in terms of the kind of treatment options which we had previously versus now. The treatments are more focused and they work on giving more natural results to patients versus what we see in our older times. We used to have a lot of bulkier faces with fillers, and patients used to keep doing fillers every few months to a more structured look that they are doing a lot of combination treatments to give them a balanced look and a younger, youthful look, what they're looking for.
What inspired you to pursue dermatology as a specialty?
See, dermatology these days is not just treating skin disorders, it's beyond that. We have a lot of patients who feel low about themselves. They have a low self-esteem because their skin is not looking good. So when we treat such people and they have a healthy, better skin, it keeps them motivated all throughout. So giving them that confidence is what boosts us also.
Looking back at your career, what has been the most rewarding aspect of being a dermatologist?
See, being a dermatologist, you have the capability to bring a change in anyone's life. You can change their looks, their confidence, give them motivation. And lot of we have seen over my journey, I have seen many young brides getting married because they were not able to get married easily because of skin concerns, because everyone wants good looks these days. And after treatments, when you see them happy, that's what makes us happy also.
How do you see patient expectations changing in today's aesthetic practice?
We see a lot of change happening thanks to the social media. The patients come with a lot of awareness about different modalities, different skin regimes, what they can do for your skin. But it's important for us to teach them that they should not go according to the trends. Rather, they should be given a regime which suits their skin type, and every regime needs to be individualized. Along with this, they need not become a different self of themselves. They need to be the best of what they are. That's what we need to teach them.
What are the biggest trends you see currently in facial rejuvenation and aesthetic dermatology?
What we are seeing the change these days is previously we were treating aging faces with just Botox and fillers. So there's a lot of focus towards regenerative medicine. We are seeing younger patients coming. So there is a focus on preventive dermatology. Let's say we can have a patient in 20s also who's coming that I am having a forehead line, so I would like to take Botox. So that's a big change. We are not looking for volumized faces. We are looking for more slimmer faces, more sleek faces. So that's one change. And the biggest advantage is now we are combining different modalities of treatment and not just offering them one modality of treatment. Let's say we might combine a facial slimming procedure with a little bit of filler to give that look what they're looking for.
How has the concept of natural looking results evolved over the last few years?
Previously, you patients used to come and they wanted that, let's say I want a filler and it should show on my face. Whereas now we have a patient who comes and says, you will do a filler, but it should not show on my face. So that's the biggest change. People are looking for more natural looks. The focus is more on texture and skin quality improvement, which wasn't there previously.
Where do fillers and skin boosters fit in a modern aesthetic plan?
See, when we are aging, we have certain fat pads which get lost, and that leads to a volume deficit on the face. We are trying to restore that volume loss when we are doing a filler, which is typically done at a bone or a mid dermal level. Whereas skin boosters are helpful because they hydrate your skin, they improve the skin texture, and they make your skin more look more youthful. Improvement in skin texture is something which youngsters are really focusing on because they want to look like have a Korean glass appearance, which is not possible without reducing fine lines, open pores, and improving skin pigmentation. That is why skin boosters have become so popular these days.
Now, coming to the filmed art fillers, how do you choose between art fillers, fine lines, universal, volume, and lips?
See, all of these are subcategories of the filament art fillers. Let's say we can give an example that every medicine will not suit everyone. Like we cannot give a general medicine for every patient. These fillers are divided into subcategories based on what material, the consistency, and different composition they have. We have the Filmed Fine Line Filler, which is for fine line and wrinkles. The universal product is more versatile. It can be done on many indications, be it the nasolabial folds or minimum correction. We have the volume, which is for structural correction. So when we are doing an improvement of cheek, jaw, or chin line, we use this filler. And we have the lip filler, which is for lip volumization as well as to give the lip hydration, what we're looking for. So it is an individual product which has its own indication and benefits, and it's ideally not to be done in a mixed manner. You should have the correct product when we are using or doing it for a particular indication.
What techniques help achieve natural lip enhancement with art filler lips?
See, lip fillers is something which is most difficult to master because you cannot tolerate an asymmetry, and sometimes there is an existing asymmetry which you have to correct. It's a very vascular zone, so you have to be safe about the complications. So the technique I follow is by using a cannula, which makes it very safe. Chances of bruising are lesser, the lump formation is much lesser, and the overall outcome is very good. So it gives the product is more uniformly spread. So I generally do lip fillers with cannulas. I think that's my technique of doing it.
How do you manage patient expectations while discussing filler treatments?
See, a filler treatment can only be successful if you are taking a proper consultation initially. We have to discuss the concerns the patient has, what is the treatment outcome the patient is likely wants to go for, and whether it is possible or not. In some indications, we have to tell them that the quantity of product which will be required. We have to tell the patient the quantity of the product which will be required, and in many cases we give them a staged approach when the quantity is more, when the required quantity is more. This is important because if you are not counseling the patient properly and the patient is looking for a magical change, it may not happen with 1 or 2 ml of filler. It is a journey through which we need to take the patient, and we need to explain them that it might need multiple sittings and multiple treatments which need to be done to get the desired result. Sometimes we imagine a teaspoon measures 5 ml. So a one syringe of filler is 1 ml. So a very small quantity of any product cannot give you a magical change. So this all has to be told to the patient, otherwise the patient turns out to be dissatisfied.
Which facial areas are your favorite for art fillers?
See, whenever we are treating a face, we have to see the face as a whole. We initially built a foundation, which is the correction of mid cheeks, nasolabial fold, and marionette lines. And then we go for enhancement, which is the under eye dark circle correction, lips, chin area. So I would say it's nothing is favorite, but if you have a younger patient, tear trough and lip is my favorite.
What are your recommendations for jawline, chin, and cheek contouring for art fillers?
See, whenever anyone who's going getting a filler done, it's important to look on the full face as a whole unit and not just look on certain areas. You cannot approach a chin or a jawline without doing a mid face correction. After you have achieved a mid face correction, you can opt for contouring the jawline and the cheek area. And the art filler volume is a good product for it, and it needs to be done in a more subtle manner so that you don't give a very heavy jawline. So something which looks very natural and looks very elegant also.
It's time for NCTF now. What exactly is NCTF 135HA and how does it differ from conventional skin booster?
I would say NCTF is a lovely product, and recently I have really started doing a lot of patients with it. It's a very versatile product because it not only has hyaluronic acid, it has amino acids, minerals, antioxidants, glutathione. So it's like a bonus which we add on to a skin booster. Skin boosters prevent in reducing dehydration. So it hydrates your skin, it improves the skin texture. But along with NCTF, what we see is a remarkable change in pigmentation, texture. We are trying to rejuvenate the skin when we are doing NCTF. It can be done on the forehead easily, which the normal boosters don't allow us to do. So we find this product quite good.
Which patients are ideal candidates for NCTF treatment?
See, NCTF can be done for both young patients as an add-on treatment when we are correcting them with the proper filler treatment. What makes NCTF a versatile product is that we have a patient who comes for a dull skin, a skin which is dehydrated, and the patient is not clear whether the patient wants to go for a filler. It's a very good product. Very safe with almost zero downtime. The beauty of this product is that anyone who wants a healthier skin can go for it. It's not going to give you a major change in your facial volume, which you're always fearing. But it's important that you are assessing a patient, you are seeing what the patient really needs it. Let's say if a patient comes with a volume loss, so in that patient we'll do a proper filler and then do NCTF and not do it directly. Whereas if you have a younger bride who's coming just for improvement of skin texture and quality, we can directly go for this product. So we have two age parameters for it. One is a younger healthier skin which is already there with no volume loss, and a mature skin in which we will correct with the filler and then do an NCTF for skin enhancement.
What improvements can patient realistically expect after a NCTF treatment?
What they see after NCTF is improvement in skin texture, pigmentation, fine lines. They feel the skin is looking more healthy and radiant, and it's not volumized the face. That's a beauty. Especially for forehead pigmentation and under eye pigmentation, I have seen it giving very good results in which we are not able to do a lot of other treatments. So overall, it gives a healthier looking skin to the patient, and the beauty is that it doesn't volumize.
Can NCTF be combined with lasers, microneedling, PRP, toxins, or NOG based devices?
NCTF can be combined with all of these. The beauty is that each of them has a specific reason while you are doing it. You are doing a filler for correction of facial volume. You are doing a energy based device procedure for again more of facial lifting. You are doing myomodulation with Botox. So NCTF is working to improve skin quality. Whenever I choose a treatment modality combination, I do something for superficial skin, something which works on the muscle, and something which lifts the skin. So a combination is going to give the best result to the patient. These days, patients have less time to visit again and again. So we are trying to combine safer combinations. So we are trying to have safer combinations which we can combine even in the same sitting. So after an energy-based device has been done, even you can do NCTF within the same session, or you can combine it with Botox and NCTF in the same session. So it's not a problem at all.
What are your preferred injection techniques for NCTF and why?
See, NCTF, we have to inject in the dermis. So we are doing it intradermally and just creating a bleb and settling the product. We mark the area wherever we need to inject more, though the product can be done on the full face. But on areas which are more pigmented or need more attention, we try to focus on those areas. So we mark the area and we can easily do it by creating a bleb.
What treatment protocol do you commonly follow for NCTF 135H?
See, we first need to assess the patient. We need to address the patient's concerns, look into skin texture, fine lines, wrinkles. And the NCTF is done at least, we recommend 3 sessions, which are spaced 3 to 4 weeks apart, because skin cannot change overnight. We need to regularly do procedures to have the enhancement what we're looking for. So, minimum of 3 sessions and then followed by 3 sessions maintenance to maintain that improvement what we achieve.
डॉक्टर अगर मैं आपके पास लिप फिलर्स के लिए आती हूँ बट मैं उसके लिए आइडल कैंडिडेट नहीं हूँ तो हाउ डू यू डील विद इट?
See, first is I'll understand why you want to go for lip fillers. आपका क्या reason है जो आप lip fillers कराना चाहते हो? Mostly it is the viral social trends what you see on Instagram which you follow and you want to become like this. Then we'll show you before and after pictures that अगर आप इसको कराओगे तो ऐसा लगेगा कि आप ऐसा चाहते हो. You have touched a very good topic because बहुत ज़्यादा time हम overfilled lips देखते हैं. उनको देख के पेशेंट लिप फिलर ही नहीं कराना चाहता, जिसको कराना चाहिए वो भी नहीं कराना चाहता। तो हमारे को पूरा फेस एक बैलेंस्ड एंड प्रोपोर्शनेट मैनर में अप्रोच करना होता है। So what if you come to me, I'll first teach you about what you need to do and not do it for you. बहुत बारी पेशेंट्स फोर्स करते हैं तो फिर हम उनको समझाते हैं कि आप अभी मत कराओ, वी ट्राई टू गेन टाइम एंड टेल देम दैट दे आर बेटर ऑप्शंस व्हिच कैन हेल्प योर स्किन। सी बहुत टाइम यंग गर्ल्स होती हैं, कॉलेज गर्ल्स होती हैं जो आती हैं, तो उनको मोटिवेट करना और समझाना और राइट ट्रैक पे लेके जाना भी ज़रूरी है।
डॉक्टर, आफ्टर द प्रोसीजर खुद पेशेंट का कितना रोल होता है रिजल्ट्स कंटेन करने में एंड पेशेंट को क्या क्या करना चाहिए?
See, most important is whenever you get a procedure done, you should follow the post procedure instructions. जैसे आपको हाइड्रेशन अच्छा रखना है, सन प्रोटेक्शन फॉलो करना है, यू हैव टू मेंटेन asepsis on the site where you have injected the product. You should not be doing exercise or too much of physical activity immediately after. So all this is something which we tell the patient, but it is important for you to follow it. Important is आपने लिप फिलर कराया और आप लिपस्टिक लगा के बाहर नहीं जा सकते, तो ये सब इम्पॉर्टेंट है। इन सबको एक रीजन है जो एज अ डॉक्टर पेशेंट्स को बताया जाता है, बट many a times we have patients who do not follow this, so that leads to compromised results. So if you're not maintaining hydration, because see, when you're doing, let's say, a filler, it's a hyaluronic acid molecule which is going to absorb water and hydrate your skin. आपने water ही नहीं लिया, आपने skin को hydrate नहीं किया, तो आपका result सब optimal रह जाएगा। Also important is that you are following the instructions for the desired amount of time and waiting for the adequate time to get results. That is important.
मैम टोनर यूज करना पैसे वेस्ट है या सच में वो वर्क करता है?
सी, इट्स इम्पॉर्टेंट कि आपका स्किन टाइप कैसा है। अगर आपका स्किन ऑयली या एक्ने प्रोन है, देन टोनर इज गोइंग टू रिड्यूस द ऑयल एंड रिड्यूस द साइज ऑफ योर पोर्स। वेराज इफ यू आर यूजिंग एन अल्कोहल बेस्ड टोनर जो आप ड्राई स्किन पे यूज कर रहे हैं, तो आपका स्किन इरिटेटेड हो सकता है। सो बिफोर यू बाय अ टोनर सीइंग एन इंस्टाग्राम ट्रेंड, फाइंड आउट योर स्किन टाइप एंड देन यूज इट।
Doctor, before we conclude, let's have a quick rapid fire round. The first answer that comes to your mind.
Okay.
Your favorite injectable procedure?
Teardrop fillers.
One facial area that creates the biggest transformation?
Lip fillers.
Your favorite injectable procedure?
Teardrop fillers.
One facial area that creates the biggest transformation?
I think lip fillers because it gives you elegance.
Most underrated aesthetic treatment?
Toxins.
Most common fillers myth that you heard from patients?
People feel the face will look artificial, which is, if you're doing it rightly, not true.
If you could master only one aesthetic procedure, what would it be?
It is fillers because that's the most difficult to master also.
Prevention or correction?
Prevention.
One word to describe NCTF 135H.
I would say it's a combination of skin booster with rejuvenation.
One word to describe art fillers.
Precise and predictable.
Fillers for lip or tear trough.
Lips.
Coffee or tea.
Coffee.
Early morning clinic or late evening.
Early morning.
Conference speaker or workshop trainer.
Workshop trainer.
Your favorite city for conferences.
Mumbai.
One mentor.
My guide, who always told me that whenever you start seeing a patient, forget everything else in the world.
One person who has influenced your career the most.
I would say my teachers.
Are you a planner or go with a flow person?
Planner.
When you want to disconnect and recharge, what do?
Go for travel or shopping.
Fantastic. Thank you, doctor. That was insightful and fun at the same time.
It was a great fun for me also, and I wish all the viewers that whenever you choose a dermatology treatment, understand the treatment, understand what the treatment is going for you, so then only you can have the face what you're looking for.
We truly appreciate your time and contribution to this discussion. On behalf of our entire team, Aesthetics Zone Medisys Private Limited, thank you so much for joining us today.
Thank you, Arsha.